platelets and blood clotting. Like, share and subscribe for more informative videos. Platelets, also known as thrombocytes, are small, colorless cell fragments found in the blood. They are formed in the bone marrow and play a crucial role in the process of blood clotting or hemostasis. When an injury occurs, platelets are activated and they adhere to the site of the injury to form a plug, which helps to stop bleeding. They also release chemicals that attract other cells involved in blood clotting, leading to the formation of a stable clot. Platelets have a lifespan of about 7 to 10 days and are constantly being produced by the bone marrow to maintain the appropriate levels in the blood. Abnormalities in platelet numbers or function can result in bleeding disorders or clotting disorders, which can be diagnosed through laboratory testing. Blood clotting. Blood clotting, also known as coagulation. Blood clotting is a natural process that helps the body stop bleeding after an injury. When a blood vessel is damaged, platelets, small cell fragments in the blood, and clotting factors, proteins in the blood, work together to form a blood clot to seal the injury and prevent further blood loss. While blood clotting is essential for healing, it can also become a problem when it occurs inappropriately or excessively. Blood clots can form inside blood vessels, which can block blood flow and lead to serious medical conditions such as deep vein thrombosis, DVT, pulmonary embolism, stroke, or heart attack. Several factors can increase the risk of abnormal blood clotting, including genetics, certain medical conditions such as cancer, obesity, pregnancy, and the use of certain medications such as hormonal contraceptives. If you have concerns about blood clotting or suspect you may be at risk, it's important to speak with your healthcare provider who can provide an evaluation and advise you on the appropriate course of treatment. Thanks for watching.